you experience low back pain that stops you from sitting for more than 20 minutes at a time because you start to feel discomfort in your lower back and numbness in your toes? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you a case study of a lady who we met recently here in our clinic. This lady is in her mid-60s and she's been experiencing low back pain for a long time. However, recently she's found that it's gotten worse. She's struggling to sit for more than 20 minutes. She finds that the pain in her lower back gets very uncomfortable, but she finds the numbness in her toes the worst part about it. She has tried different types of therapies and she hasn't had any long-term relief. Life is just getting a little bit more unsatisfactory and frankly, it gets her down. So she heard about us and came to us for a second opinion about is there anything that she can do because she's really struggling to get through her day now. We did a full assessment of her spine down to her lower back and around her hips where she felt the pain was worse. What we found was that she actually has a slight scoliosis in her spine. That means that there was a slight curvature in her mid to lower back, which causes a muscle imbalance for her. And so she was getting a lot of pain and tightness on one side because the spine is not straight. Then when we looked at her lower back, she had a lot more of a tilt. So she was tilting her pelvis back like this a lot more. And that was causing a lot of low back pain, swelling and inflammation around her tailbone, as well as around her hip area. When we had a feel, there was a lot of stiffness, inflammation in those two joints, her sacroiliac joint, so where the arch of your pelvic bone is meeting with that tailbone. So along there was a lot of pain, and when we pushed on those joints, it resulted in pain down her leg. So really, for this lady, the reason why she's had her back pain for so long is because she actually has, one, a mild scoliosis, two, an exaggerated lumbar lordosis. So the spine and lower back was tilting a lot. And over time, unfortunately, there's a lot of wear and tear, inflammation all around that area. And number three, she had arthritic changes in her sacroiliac joints around her pelvic bone there. So now we know the cause of her back pain. We could explain to her and educate her. Now, what's the solution, you might be wondering? The solution for her was we were able to work through all that muscle tightness, inflammation. We were able to reduce all of that and all that tightness up to her upper back and even up to her shoulders. The way we did it was we actually used our radial shockwave therapy machine, which you see back there. It worked effectively to release all that muscle tightness. It helps with the inflammation, helps with tissue recovery so that all that swelling went down, that muscle tightness eased, and she was feeling a lot more comfortable. We then had to work on all the joints that were stiff and out of alignment because she was walking often in a bit of a tilt, partly because of her scoliosis and partly because of the posture she always adapted over such a long period of time. So we were able to do that to help take off the edge of those constant sharp pain, and she was able to sit comfortably for more than 20 minutes at a time. However, long term, what she needs to do is to keep that muscle and her joints all more flexible, and we recommended that she starts doing some regular hydrotherapy. So exercise in a warm pool will help keep those joints as mobile as possible, relaxes all her muscles on a regular basis so that she can stay active. So she's quite pleased now after 6 weeks that she's certainly got back more energy. She's not in pain. She was able to engage in her activities that she loved, gardening, and so she could do all that now without pain. It is about maintenance and long-term care for herself and keeping active, and certainly she may require some physiotherapy top-ups as she goes because the muscle tightness and stiffness may return. So if you're out there and you're experiencing low back pain constantly for years now, and you're wondering if there's any help out there for you that doesn't involve medication, why don't you ring us here at My Favorite Physio, speak to one of our expert physiotherapists. The number to ring is 0297904233. And if you know somebody out there who's been putting up with low back pain, why don't you like and share this video with them? Until next time, have a fabulous day. Bye.